The more infectious COVID variant, first found in the United Kingdom, now spreading to more U.S. states. New York Governor Andrew Cuomo confirmed the first case in upstate New York yesterday. That state joins California, Colorado, and Florida in reporting the new variant. Joining me now is Tampa General Hospital emergency room medicine physician, Dr. Jason Wilson. Dr. Wilson, are you concerned about this variant? To be blunt, how big of a deal is it?
Well, the concerning part here is that this variant seems to be more transmissible. And the problem we have there is that we already have a virus that infects quite a few people from each person who has it. And so if this virus variant is 60 or 70% more infectious, and even the normal variant of the COVID virus infects 2 to 3 people, now we might expect that each person could infect 4 to 5 people. And that's concerning when we know we're still struggling with public health measures and getting this vaccine rolling out. How
much are you struggling in your emergency room where you are in terms of the volume of patients? California is just... There's a story that ambulance drivers or EMTs are being told, like, don't take people to the hospital unless if they think that they're not going to make it. And that's somewhat like what was happening in New York in the spring.
Sure, and we certainly don't want anybody to not come to the hospital and needs to come to the hospital. And we've had a lot of time to prepare for this at Tampa General. You know, this goes back to March now. And, you know, we went through March, April, and May with a pretty low number of cases in the Florida area, but then really spiked and surged in July. And we learned how to create new capacity, think about how to get patients through the hospital safely and efficiently. And we're using that knowledge now. We've actually opened up a new infectious disease hospital where we put a lot of our COVID patients. And so the fact that a year ago we didn't even know there was a virus to where we are right now, which is pretty safely operating with this virus with us, is pretty tremendous. And so we do have challenges. We have a lot of people with COVID right now, and we're concerned, you know, about the holidays and the gatherings we saw around the holidays, that we're probably going to see another surge coming up in the next couple of weeks as well.
Florida Governor Ron DeSantis signing an executive order in December which puts people who are 65 years of age or older in the first priority group for getting the COVID vaccine. But there have been some issues with the rollout, including long lines, confusion on how and where to register, and then difficulties in making appointments. Dr. Wilson, what is your take on this? Because I know no one in New York who has been vaccinated. But I know people in South Florida who were contacted by their hospital saying, come in and get vaccinated because they're older. So it's really, because people are eager to get this vaccination, which is hugely positive. But here in New York, if you have to essentially work in a hospital to have gotten it.
Sure, and I understand the urgency around wanting to get this vaccine. You know, every day that goes, should be some urgency there. At the same time, we have to remember that, again, a year ago, we didn't know the virus existed. We sequenced the virus, we created a vaccine, all in really record-breaking, moon landing level time, and now we're having to stand up a brand new process. And it's hard to stand up new processes, especially in situations where you haven't really done this type of a process before, a mass vaccination campaign, you know, in situations where hospitals may be getting the vaccine, but trying to give it to people who maybe aren't hospital employees or hospital patients. You know, at Tampa General, we received the Pfizer vaccine in December. We were one of the 5 hospitals that received the Pfizer vaccine, and we were able to distribute that vaccine now out to other hospital systems. You know, that's a different thing than we normally do. And then start to work with the Department of Health to distribute vaccine as well. So it has been a little bit clunky, but I think what you're going to start to see is the speed really ramp up. You know, the governor of the state of Florida yesterday has committed more resources
Dr. Wilson, we got to jump.
We
have to jump. I apologize for cutting you off. Please come back. Dr. Jason Wilson.